friends and colleagues from all around the world. Thank you for joining us. Today we have a very special occasion for you and a webinar that pertains to the hottest topic in dentistry today, infection control post-pandemic era. Today we have two special guests tuning in from Iowa and Portland, United States. Dr. Downs and Dr. Zelk, thank you for joining us.
Yeah, thank you. Welcome.
Thank you for having us.
Thank you. These gentlemen have gotten together and designed a very much anticipated presentation, as we are receiving a lot of different information from different people. And they have created a very, very informative lecture for us today, for our colleagues all across the world that can use some of this information in preparation of getting back to our practices and going back to our full-time businesses. With that said, I would like to quickly introduce Dr. Downs and Dr. Zelk. A little bit of background. Dr. Downs actually participated last year in our Global Executive Summit, and we got to know each other quite well since then. But in the gist of it is that Dr. Downs attended a college on a scholarship in chemistry and graduated from University of Iowa, earning a Bachelor of Science degree in 1971 and a DDS degree in 1975. So he must have been at it for 4 decades now. After graduating from dental school, Dr. Downs spent 3 years as a Lieutenant Commander Navy Dental Officer at the Great Lakes Naval Center. He's past editor and president of the Iowa Academy of General Dentistry. He has attained fellowship awards from the Mish Implant Institute, the International Congress of Oral Implantologists, and the Academy of General Dentistry. He's presently vice president of the Global Mini Dental Implant Association and founder of Sleep Disorders Treatment and Consulting Organization, including online home study testing center. He co-founded the company Oral Care Products that I'm quite familiar with now, that now manufactures and sells oral care mouth rinses and oral care post-op implant care systems across the world. He's a stockholder in the healthcare infection control company Topin Health at topinhealth.com. Wow, Dr. Downs, you've been very busy and you continue to go at it. Maybe you can give us a little bit of an idea what your motivation is.
Well, I've been in practice, as you said, for over 4 decades. I sold my practice a couple of years ago, and now I'm really fascinated by the things that you're doing, Keanu. I was so pleased and honored to be at your global conference last summer. I met people from all over the world. You're doing a phenomenal job with spreading the word of dentistry and quality dental care and innovation throughout the world. I'm totally impressed. I will follow you every day, and I'm so impressed with what you're doing. I've got to meet people from all over the world through you. And so when Dr. Zelk and I have been working on sleep disorders programs and education for dentists, and we were collaborating together, and then this pandemic came up in January, and all of a sudden I realized that I'm the stockholder in 2 companies that have the exact kind of products that we need to have a safe practice to go back to work. So I talked to Joe. We decided to work together. He's developed a fogger and other things that are going to be useful in our program. And we just clicked, and all of a sudden this thing has exploded. People are sharing our webinar all over the world, and we're really honored to be part of this one as well.
Yes, thank you.
We're honored to have you, and our motivation is peer-to-peer collaboration. I'm glad you guys started a peer-to-peer initiative together, and that brought much knowledge and information, complementary to our colleagues from around the world in the most distant places. Quick introduction of Dr. Zelk, a friend from Oregon. He's a diplomat of the American Board of Sleep Dentistry. Dr. Zelk is the CEO of Sleep R&D LLC, a medical device manufacturer and owner of the Sleep Medicine Group. Dr. Zelk is also double board certified in behavioral sleep medicine. He's a nationally known speaker on sleep disorders. He has been an invited expert for sleep disorder and interdisciplinary practice in sleep medicine. Dr. Zelk is active in the development of novel mandibular advancement devices to help promote the field of oral appliance therapy for OSA. He leads the charge at the sleep medicine group to be in the forefront of both oral appliance therapies and hybrid therapies of oral appliances with positive air pressure involved. He has also co-developed an interdisciplinary algorithm for the treatment of obstructive sleep apnea and complex sleep apnea as well. So you guys know that these are all really hot topics: sleep apnea, infection control. We all the numbers are staggering of people that have sleep apnea issues. With that said, gentlemen, I'm gonna go ahead and mute myself out and have you have the floor to begin your presentation. Let's go ahead and bring up the presentation.
There it is.
And I'm gonna go ahead and take him out. And there we go.
Make sure that Dr. Zelk is live here too.
Dr. Zelk will be doing the slides, and
Yes,
he will be able to also speak in the back, explaining the slides, and I'll mute everyone else. You have the floor, gentlemen.
Great. Tell me if you can see how I'm moving this here. Yeah, can you hear me okay?
Yes.
Great. Rick, how about you? Can you hear me all right?
Can we hear Joe?
So right now, I can be heard, but Rick is not able to hear us.
My introductory page.
Hang on one second, and you may have to keep Rick in the conference. There you go. Go ahead, please proceed.
Okay, Rick, are you able to hear me?
Can you hear me okay? Because I'm we're both presenting here, and Joe is handing the slides. There's Dr. Joe's introduction and in the different parts of the sleep medicine group that he is working with and is president of. So I'm very pleased to show you that we don't need to go through much of this disclosure. We do develop these products and market these products that we're talking about today. So. The whole office mitigation topics are going to go over many different subjects here, and they mainly go around three pillars that hold up the stool. And we're talking about mainly air purification, and we're talking about surface purification, and we're also talking about waterline cleaning and the ways we go about these three different pillars that we want to make sure people come into an environment that is completely safe or super safe, at least I should say, in the areas of air, water, surface, and operatory aerosols. And we want to talk about aerosols as well. So that's what we're doing. Go ahead, next. Problems we need to solve. Well, they would include, dental handpiece creates aerosols. Those aerosols contain SARS, the COVID-19 virus. Surface disinfection products don't kill the virus or the toxins. Many of them don't. Waterline disinfection is not happening at below 500 CPU. In the U.S., that's the standard. In the Europe, it's actually 100 CFUs. And with whole office disinfection and quality control issues, we need to go and address all three of these pillars. Oral preoperative disinfection rinsing and COVID-19 monitoring. We're going to talk about that, and staff protection. Many of the staff, by the way, are afraid to come back to work. And I've heard it many times. Hygienists are talking about aerosols, and they're worried about going back to work. We want to make sure that people are able to feel safe, come back to work, the doctors and the staff. Viruses that you need to know come into the saliva from the clavicular fluid. So we don't have any proof yet that COVID-19 comes out through the clavicular fluid around the teeth, but we sure know that they do under other circumstances. Dr. Jorgen Slotz from the University of Southern California has mentioned that cytomegalovirus, different types of herpesvirus, Epstein-Barr virus, come out of the clavicular fluid. So we can assume that while we're working, that other viruses like COVID-19 would also do that. And here's a kind of an explanation of the well, just kind of a dramatic video or a shot of staining the saliva in the mouth, and how that dissemination of the aerosol splatter, if you actually highlight it, shows up around the patient and on the surfaces around the patient and on your own gloves and uniforms and masks and protective eyewear. So it's pretty dramatic picture. Okay, next. And we will address these topics. They're going to be a whole office disinfection, as we said before, surface disinfection, solutions that are safe and effective. Many of them are not safe that we're using now. Ozone water treatment as a possible alternative for some of the things that we're doing in the water bottles in the operatory. Reverse osmosis and deionized water sources and how to use those in your office to help improve infection control. Waterline disinfection, whole office water disinfection, not just the water lines to the operatory chairs. We're going to talk about hypochlorous acid and surface disinfection and fogging for PPE, for personal protective equipment, and even some of the things about what we can do with fogging tunnels. Pre-rinsing, mid-procedure rinsing, and post-procedure rinsing. The pros and cons of different products and those are things. A note on the delivery and installation. We need you to know that right now with this pandemic, there's been a very big crush in orders for these products. And so some of them are delayed. The bottles are being very difficult to find right now to even package our products. So we can't guarantee that you're going to get immediate delivery if you want to order some of these products. It's very important that you know that. Okay, next. Here's an interesting slide from China. Okay, and here you see a restaurant in which people at one table who were COVID infected were the people at another table were infected by the HVAC system. And in other words, the viruses traveled through the air conditioning and heating system, was blown out into other sections of the restaurant, infecting other people. And they tracked this. So we know that HVAC and whole office air is being circulated with these virus particles in this restaurant. We can assume the same thing will happen in a dental office. And so we need to know how to handle that. And so we're going to address that with an ionization system that we think is the best on the market for that kind of thing. The next, please. Let's go to the next slide. There we go. So we're going to talk about negative air systems too. There's been a proportion or a advocacy of some negative air systems in dental offices that would look like they would in a hospital where they have lower pressure of air in the operatory as opposed to the rest of the office. So none of the air that comes into the operatory is actually escaping into the hallway and the other parts of the office or through the HVAC system. These systems are very, very expensive to do. And even they're so difficult to do, you have to tape up cracks in the hull, like the electrical outlets, cracks in the ceiling. It's almost impossible to do in a dental office. We believe that the last figure I saw was $40,000 per operatory. We feel it's going to be very difficult, if anything, to do this. Although I think there are going to be people that will be able to do this in the future. I'm just not so sure it's very practical, and it's certainly not going to address the problems with the viruses in the waiting room. So let's talk. We'll talk more about that later. Oh, by the way, only 2 to 4% of hospitals even have these systems in them. Problems with different disinfecting agents like the quaternary ammonium products and the glutaraldehydes. They have a toxic, they are toxic. As a matter of fact, the carriers that they use in these products, alcohol, readily volatilizes in the air. So it brings these toxins up into your lungs. Now, these toxins aren't so bad if you get them on your skin, but when you breathe them into your lungs, they immediately enter your bloodstream. So if you notice people in your office coughing while they're using these products, you can tell that it's actually causing irritation. Over the years, these toxins are problems for people in the working environment. Not only that, but over time, it can create problems. And we've got studies to show that that these products can cause chronic problems like asthma and exacerbations of breathing issues for people. These volatile sulfur compounds that also are produced are not inactivated by these products. And here's one of the articles that talks about these products and what they do. As you can see in the citations here, they cite quaternary ammonium products, even chlorhexidine, and other types of cleaning products. These are not regulated like the products that we use in our offices that have material safety data sheets. As a matter of fact, these don't have to have them. And so a lot of the products under the sink that you use to clean are toxic to your breathing mechanisms, and they cause a number of severe illnesses. And over time, they've shown that in places where these products are used regularly, that these diseases exist. So let's move on, Ben. Toxic. Yeah. Excuse me. Okay. Very good. The sink that you use to clean are toxic to.
I think it's some reverberation there.
I got part of the question, but anyway. So anyway, the problems with chlorhexidine pre-rinsing. If we're talking about mitigating aerosols coming from the mouth, by the way, the CDC has recommended pre-rinsing for many, many years. It is a standard of care issue, but yet less than 20% of dental offices have been doing pre-rinsing. At one time, the CDC recommended chlorhexidine as a pre-rinse, but now with this COVID-19 issue, chlorhexidine has not been shown to be very effective against this virus and pre-rinsing. One thing nice about chlorhexidine is it's very good against bacteria, and it has a product a characteristic called substantivity. But substantivity is not something you want in a pre-rinse. You want something that kills quickly. Substantivity is not an issue with pre-rinsing. You want a fast kill, and also the CDC has recommended an oxidizing agent. And so oxidizing agents are what they recommend for quick kill of the coronavirus and other viruses. So let's go ahead and move to the next one here. And they have recommended hydrogen peroxide. Hydrogen peroxide does kill quickly, especially on a in vitro study. But in vivo, it has less good results. In other words, it's inactivated by catalase. It has been shown to inhibit the formation or the function of fibroblast. It's also been shown to inhibit the function of osteoblast. It's certainly not something you want to use in the presence of a surgery. As a matter of fact, physicians have routinely abandoned peroxide in surgeries. This has caused hip implant failures, and it's also a risk of embolism formation in a closed wound or a semi-closed wound. So there are problems with peroxide. In one study, we saw that after a study was done on wound healing, that it was no better than lactate ringer solution or povidone iodine in healing wounds. So I don't see a lot to recommend hydrogen peroxide. It has been good as a good product for help re-sterilizing N95 masks, though. And so we do recommend that you use it for N95 masks. And I think it has application on in vitro surfaces. Now, here's a product that we do not carry, but I think it's a good one. We've looked at it. It's called the Relief Suction. Saliva ejectors are not a good solution for reducing aerosols in the mouth. In other words, they just don't suck enough volume. Now, there are some systems out there that we like, and so we saw this one that was listed on another forum that I looked at. It's a little, it's actually a large suction that sits in the cheek. It has a high volume suction. It goes to your high speed vacuum, and it'll help reduce aerosols dramatically. For hygienists, this would be a good product because it sucks in the aerosols very quickly. There's also another one called Zuction, Xuction, or it's spelled with a X instead of a Z, and it sits on with cheek retractors on the lower lip and also catches aerosols. These are very nice because these kinds of systems, I think, can help reduce a lot of the aerosols that go into the air. I like them better than these large suctions that you have with nozzles that mostly sit over the patient and hook up to a large vacuum system with a Hepa filter. The problem with the Hepa filters are their micron size is 0.3 microns or larger, and the viruses range anywhere from 0.004 to 0.1 micron in size. So I'm not sure I see the point in a suction system that would suck in a virus with fomites and then expel the virus into the room. Okay, I just don't, but I do think one that suctions the viruses and the aerosol into the regular suction system that you have in the offices would be a good one. So high volume suction in itself, just a high volume suction with your assistant beside you, already removes 90% of the aerosols. So we just need to continue to reduce that aerosol size, and we don't want to do it with saliva ejectors. So let's go to the next slide, please. Go ahead, next slide, if you would, please. Okay. Now, these are some of the systems that we've been, that have been advocated over the internet. All of them have their advantages. Certainly, a face shield of some sort is recommended to protect the eyes and also some of the splatter that may get on your mask. We want to make sure that we reduce the amount of that. Now, and also they've recommended pre-screening patients and your staff with thermometers each time they come into the office. I agree with that, but we have, I think, something that will even diagnose or help you pre-screen for COVID-19 earlier than a thermometer will do, and we're called that, and we're mentioning pulse oximeters because there's a drop in oxygen saturation in the blood long before people notice that they have a problem with breathing, and that actually happens before you would notice a fever. This is an X-ray, or actually a photo of the operatory and showing where the different contaminants go. As you can see, it's all over the operatory, and they've done studies on this with touching and aerosols and how we need to address all these different areas of cross-contamination. Next slide, please. Go ahead to the next slide, please. Yeah, right. There we go. Now, this is an older recommendation for pre-rinsing. As I said before, the CDC has established that pre-rinsing is absolutely necessary, and it is the standard of care. Well, now with the pandemic having come, you can be sure that this is going to be at the forefront of aerosol control. Pre-rinsing, on this old recommendation, you see chlorhexidine listed there. And chlorhexidine is now not the standard of care for pre-rinsing that I see the CD recommending now. It used to be, but these are outdated. But still, just looking at this, you can see that it's been recommended for a very long time. And you can see also the high volume suction. There are many kinds of N95 masks, and again, with the shortage of these masks, and the fact that they actually filter not only through filtration but also ion electrostatic attraction, we want to make sure that when you reuse these masks or repurpose these masks with hydrogen peroxide or UV light, and we're going to talk about UV light as a way to do that, then you don't want to destroy that polarization or that electrostatic function of these masks. They can make them less effective. Here's the one that we found that I believe is very effective. This one's been shown to use UVC light. UVC light is what you want for re-sterilizing or repurposing a mask. You can do it in 5 minutes with this machine at 254 nanometers of wavelength. And you want to make sure it's UVC light, not UVA or UVB light. You can't use a nail salon ultraviolet light for repurposing your masks in the office. It's not going to work, but these are work. Okay, so centers, this information comes from the Centers of COVID Innovation. And you can see that the UVC light is recommended, not a UVA or UVB for any N95 mask. So it must be a 254 nanometer wavelength, and Lumen has that. At 90% of the time that it's on, it will do that at 254 nanometers. It must be at a power of greater than or equal to 1 joule per cubic centimeter for 5 minutes. And you must, it does not work. Sunlight does not work for decontamination of N95 masks. It must decontaminate after every aerosol procedure with peroxide or UVC. This is what the Centers for COVID Innovation has written, and I agree with it completely. Next. Go to the next slide if you'd like. There you go. How do we control the contamination in the waiting room and the common areas? Now, this is the problem that we need to discuss, because you might be able to control the contamination in the operatories. You may be able to get a negative air system, but I'm pretty sure that if you don't have a negative air, complete negative air operatory, you're going to get aerosols in the hallway. Besides that, there are patients in the waiting room that may be coughing or bringing and shedding viruses in the other areas and in the hallways. You can't just control air problems within just the operatory. I believe you need a whole office air disinfection system. And so this is why we're recommending, of course, hand washing, and then also hypochlorous acid. We can also use hypochlorous acid if it's a low enough concentration to decontaminate your face after a procedure. You can actually wipe your face with hypochlorous acid at the right parts per million concentration. You can change your clothes before going home. And of course, you want to do that. And you may want to have rewashable gowns. I think if you're going to constantly go with disposable gowns, we're going to create quite a landfill problem. But I mean, that's nothing wrong with that if you want to do that. And then, of course, PPE is very hard to find right now. So we are looking for ways to decontaminate PPE. Let's go ahead to the next slide, please. Okay, so the Lumen CPAP sterilizer we just showed you, it allows for UVC light. And I don't think we need to go into that again. That's just another slide that recaps what that Lumen does. Solutions to these issues: pre-rinse with an oxidizing agent then to mitigate aerosols. Waterline systems have to be improved. Whole office air must be cleaned. Surfaces in all office need a solution for air treatment. Operatory bottled water disinfection in multiple to mitigate aerosols. Excuse me. And water reverse osmosis and deionized water is something that we recommend for these water bottles. The systems that we recommend are active chlorine dioxide, pre, mid-rinse, and post-rinse. Hypochlorous and bottled water and surface disinfection, ozonated water systems, ion air, office air treatment to kill the viruses in the air and on surfaces. I'm going to talk about that a little bit later. The ionization of air, if it's at high enough level, can actually sterilize or disinfect surfaces. Ultrafilter water filtration instead of chemical filtration, and high resolution pulse oximeter rings for the preclinical referral or screening for COVID-19. So ozone production used to be done from air, and we don't want to do air because just room air produces nitrates when you go through these ozone making machines. These have to be hooked up to a pure oxygen bottle. You cannot use air in this situation. It doesn't make enough concentrated ozone. Now, here's one we found that we do recommend. This particular machine was developed by Dr. Rainey and is sold by Dr. Rainey in Texas. And it produces water, actually ozonation from water. In other words, you don't need air bubbling through water to make ozonated water. You can actually make ozone directly from water. and it comes in at 12 to 18 parts per million. And what's remarkable about that is you only need about 2 parts per million to have an effective a virus and actually all pathogen killer. It's an amazing machine, and it puts out a fairly quick output of water. You can use this water in your ultrasonic machines, also in your water bottles, in your operatories to help with going through handpieces. It removes biofilm and kills pathogens at a remarkable and fast rate. Ozone is one of the most powerful disinfectants ever discovered, and it can be used in multiple ways in your office to not only clean water lines and water bottles, but it can be used for surface disinfection. Now, we recommend a reverse osmosis deionized water system. This particular system here produces water that you can put into your sterilization autoclaves, and also you could put into your water bottles. And if you combine it with the ozone making machine, in other words, if you had a system where you actually used reverse osmosis deionized water that directly fed into the water ozone maker, you'd have a really efficient system for making ozonated water. Now, this slide is about just of an interest. I just want you to know that Spain has actually started using ozone to treat COVID patients, actually doing it IV. And they do it in a couple of ways, but what they're usually using is removing the blood. They ozonate the blood. Then they use ultraviolet light to remove the ozone and bring the blood back into the body. And they're treating COVID patients in Spain with ozone right now. First time I've seen that happen. It's pretty exciting to me. Water purity. We want to talk about what systems we have out there now. We usually have chemical treatments for water purity and what we use in our water lines. What we're recommending is an ultrafiltration system. We also think that it can be useful for the whole office because of ultrafiltered water going into your reverse osmosis machine will help because it removes the nutrients that the bacteria use to multiply. And these reverse osmosis machines often have reservoirs that grow biofilm, so it defeats the purpose of what you're trying to do in the first place. So you want to mitigate the biofilm formation in the reverse osmosis machines. We've seen these around. There's a SteriStraw. It uses silver to kill the microbes. What you have to do with these, though, is you have to figure out what are the total dissolved solids in your water. And they have two different types of straws for determining first how much total dissolved solids are in your water. These do work, and you do have to figure out the dosage and the straw you want to use for that kind of system. We like this ultrafiltered system. Ultrafiltration can remove bacteria. These systems at 8 logs. Okay, that's a lot. Viruses at 6 logs, and then spores at 4 log reduction. Not only does it use filters, but it uses an electropositive retraction inside. So even though the pore size is removing a tremendous amount of bacteria and food particles that feed the bacteria, the electropositive part of this filter also takes and removes the remainder of the viruses and the pathogens in the food. And even with ultrafiltration, if you look at the water line, and you'll see within this water line that the biofilm has been reduced with no chemicals whatsoever. It's almost completely gone. And with the ultrafiltration system, if they do a once a year flush with hypochlorous acid, you get remarkable clean lines, not only in the operatories, but all the water in the office, not just the operatories. So you want to be able to also kill the surface problems in the computers, the doorknobs, the countertops, the operatory disinfection. So you want to use a frequent and often use of hypochlorous acid. And we're going to talk a little bit about hypochlorous acid. What it is hypochlorous acid is a natural product that your cells produce. Within the cells of your body, hypochlorous acid will be, once they phagocytize, you can see the green part there is a staph infection. This is the white blood cell. it engulfs the staph infection, and then it brings it back into the cell, into vacuoles, and it kills it with hypochlorous acid. It is akin to bleach, but it's not bleach. It is an actually much safer product to use, and it's much more effective. It's actually 80 to 100 times more capable of killing microbes than bleach is. So hypochlorous acid is a weak acid that forms when the chlorine dissolves in water, and it partially dissociates into other forms of and hypochlorous acid and chlorides. These oxidizers are in the solution, but the main product that we want to work with, and what we produce with our Dolphin Pods, is hypochlorous acid, and we'll show you how we stabilize that. Now, you can find these on the market everywhere. They're a little inexpensive hypochlorous acid machines that you can get on Amazon. We don't recommend these because, first of all, it produces a very low parts per million hypochlorous acid from salt water, and it makes a lot of unstable and extra chemicals that we don't want. And we want to know exactly what you're using when you're decontaminating surfaces. Now, there are electrolysis systems that I do like. One is by Viking. Viking makes a very expensive hydrolysis machine, and the water comes out very pure with a pure hypochlorous acid. They're very expensive, though, and there's nothing wrong with using these. I think they're fine if you want to go with the expense of a hypochlorous acid electrolyzing system. Other electrolyzing systems, they, as we said before, generate oxidants like ozone, oxygen, hydrogen peroxide, hypochlorous acid, and even hydrogen gas and salts. Some of the salts can be harmful to your equipment, but it depends on the concentration of those salts. They're not very good for fogging, so these systems that you buy at Amazon are not a good idea, because at 200 parts per million, once you fog it, the dilution of that fog to the parts per million is below effective levels. So we don't want to use these in fogging systems. And you want low water total dissolved solvents generated. And so we want to take something like this. Now, I'm recommending, and Dr. Zelk and I are recommending Dolphin Pods. These are sold by Top in Health, and we think that they are the real answer. They're portable. They come in 40 tablets per box. You dissolve that tablet, a full tablet, in a 24-ounce bottle, you'll get 6,000 parts per million. We're talking about 6,000 parts per million. Now, they put it in that strength because it's tuberculocidal. And on a dirty surface, if you want tuberculocidal activity, then you dissolve one tablet in a 24-ounce bottle. But in fogging purposes, we don't want it that strong. We want to dilute it by a tablet into one tablet per 2 gallons. And then you get about 530 parts per million. That is pretty good. That's ideal for fogging, because then by the time it reaches the surfaces, you're at about 200 parts per million, which is what we recommend in a fogging situation. Hypochlorous acid then is the same chemistry produced by your white cells. It kills bacteria, viruses. We have now developed a unique method of purifying the hypochlorous acid so it can be used safely and effectively. And that's what we're recommending. And it's also cheaper than the electrolysis systems. Now, this is a chart from a company that produces hypochlorous acid. It's not the one that we're working with, but it is a good company. I forgot their name, but I do know that they show the comparison of hypochlorous acid with alcohol, quaternary ammonium compounds, and sodium hypochlorite or bleach. And you can see the differences there. Now, each of these products, let's say, for instance, Cavicide, is also mixed with other products like alcohol. And so even though it says that quaternary ammonium products may not kill viruses, we know that Cavicide does kill viruses. So this chart is probably just used on pure quaternary ammonium. So hypochlorous acid is a natural disinfectant, sterilizer, sanitizer, deodorizer for all surfaces, including hard to reach areas. Now, it does have a little chlorine smell to it, So don't be surprised that it has a chlorine smell, especially if you have it in a high concentration form. You're going to smell chlorine. It's really harmless. By the way, the tablets, they'll have an MSDS form, and the MSDS form looks scary because of all the cautions on the MSDS form. But it's about the tablet. It's not about the rinse that you make once you dissolve the tablet in the water. It's very safe to use. So hypochlorous acid is an all-natural product, as we said. It has safety. It has superior disinfecting parameters. It removes the biofilm, is more stable than most other products on the market. And then these are some of the hypochlorous acid products that have been approved by the EPA. And this is our EPA registration number that shows it is effective against coronavirus 229E, which is a coronavirus surrogate that all products are being tested against now. You can see that hypochlorous acid in water is pH dependent. As you get acidic, you get to chlorine. We don't want free chlorine. It's not good for you. But at the range that we have Dolphin Pods, they're 6.5. So that's the optimum range for producing hypochlorous acid. Then if you go to the alkaline range, you can see that sodium hypochlorite is produced and really is not as good a product. Sodium hypochlorite has a lot of problems, as you all know. Okay, so the antimicrobial activity has been extensively studied, and it causes respiratory loss in the bacterial cell membrane, and it has an irreversible reaction with sulfur and heme-containing products. And this is just a diagram, kind of a simple program showing how the white cell engulfs the pathogen, brings it in, and destroys it with hypochlorous acid. Now, this is a product that we've seen produced in Brazil. It's a tunnel. And right now, what they're doing is they're having people walk through this tunnel, and they're being sprayed by Cavicide. We think that's a pretty drastic method of decontaminating a person by going from person to person. If you're in an operatory and you want to go do a hygiene check and you want to go through decontamination, we're not recommending Cavicide, but we can use that machine with hypochlorous acid at about 100 parts per million. There are many foggers on the market. We have developed our own, and Dr. Zelk, who is running the slides right now, unfortunately, we can't hear him. We've developed a fogger that I think is much less expensive. It's whisper quiet, and it'll produce fogging in your room with hypochlorous acid that we think is at optimal range of around 200 parts per million. You can breathe less than 280 parts per million of hypochlorous acid with no ill effects. So that's what we like about the systems that we're recommending. Okay, this is just a YouTube. If you want to show it, you're welcome to, Joe. If you don't, we can. If you can't do it right now, that's fine. Okay, we're moving on. So whole office air cleaning. Let's talk about photocatalytic oxidation. Photocatalyst oxidation systems are everywhere out there. You'll hear them discussed as air scrubbers. What they do is they have a problem with them because they tout that they're associated with the Space Administration and NASA, and they're really well hyped out there. They produce weak ions. They also produce contaminants like titanium dioxide and ozone, and we really don't want ozone in the air when you're breathing throughout the office. I don't care how low the concentration is. They talk about their concentration being below EPA levels, but the problem is the ozone does build up in the ducts, and the ozone does get more concentrated over time in the air. They have a lot of problems with those machines. You'll also see machines out there touting ultraviolet light killing of viruses as they go through the air duct system. The problem with ultraviolet light production is that the air isn't there long enough for it to do the killing that it needs to do on all the pathogens that are going through your air ducts. Now, if the light is used for destroying ozone, that's a different matter. And there are machines out there that use ozone to kill the viruses, and then they use the ozone. They have ozone. They use the light to kill the viruses, and then the ozone is destroyed by the light. I think I said it the wrong way. The ozone kills the viruses, and then you kill the ozone with the with the light, and that's a nice system. Pca filters, these are some of those smaller ones that have been used in operatories. We think one that just produces ions is a better choice. Let's move on. Hepa filters, we talked about before. Pure air surgical filters have a micron size. The smallest ones I've ever seen are 0.3 microns. That is too large to filter out viruses. And so the viruses are range. The largest one, actually the SARS-CoV-2 virus, has a 0.125 micron size, which is one of the larger ones out there. And yet it still goes easily through these micron size HEPA filters. Now, the Clean Air EXP is what we're recommending. The Clean Air EXP has 13 patents out. 8 of them have been approved so far. Major air conditioning and back heating companies are now adopting this technology into their systems and will be offer them soon. These are really amazing because it produces ions on steroid. The ions kill viruses, but more importantly, the ions are actually killing viruses not only in the air, but the bacteria, virus, and fungi on the surfaces in your hallway, in your front desk, on the doorknobs. All the hard surfaces in the offices are being decontaminated over time. And we have the studies that show that and have been tested against COVID-19, COVID-229E, which is the COVID-19 surrogate. It also kills the norovirus, which is harder to kill than COVID-19. So we know that this product is going to be really good for air breathing. And it has a little dial in the waiting room that shows the parts per million in the office. Your customers or clients and patients will see this and know that you're doing something to help them with the waiting room air as well as the hallways. So these are some of the studies. This is one from the University of Arizona on this product. It shows a remarkable kill rate for the viruses and the bacteria. And here's a comparison product mix here on all the different types of ionizing machines out there. Also, the PCO machines are listed in this product line. It is far and away the best system that I've seen for decontaminating offices. We have 3 of them in our office, one for each air handler, and I have bought one for my lake home where I'm at right now, and I've also bought one for my home back in Dubuque, Iowa. And Dr. Zelk has bought the same thing. We're excited about having those put in right now. See, there's some more statistics on the microbes that this product kills. You will see the studies. There's more than one study, of course, on the kill rate of this, and also they tested it on surface kill for coronavirus 229E, and it showed that within an hour, over 99.9% kill rate on the surfaces even. So it's an amazing product. Now we're going to talk about pre-procedural rinsing. And I think the pre-procedural rinsing is the cornerstone of aerosol mitigation. And of course, as the owner and co-founder of OraCare Products, I'm recommending a chlorine dioxide killing program. It's very fast, extremely useful, and we've been advocating it for years. Now, no one has had their product tested on COVID-19. There isn't any product out there, but we're in a university, a chemical lab in Texas right now having our product tested against COVID-229E, which is the COVID-19 surrogate. And this particular product is the one, or the bacteria or virus, is the one that all products are being tested against right now. We should have those results by the first week in June. So the standard of care, as I said, is pre-rinsing. We believe that the oxidizing agent with chlorine dioxide is the best. And so we'll go ahead and show you some of those things. Pre-rinsing is the foundation and most easily done. The CDC has recommended it for years. We are recommending that it be done for bacteria, viruses, and fungi. CDC has recommended oxidizing agents for COVID-19, which does not include chlorhexidine. Chlorhexidine is a bacterial control agent and it has substantivity, as we said before, but it's not what you want in a pre-rinse. Here's some of the products on the market. You can see Listerine on the left. It's really not an oxidizing agent, mostly oils that it uses to kill these natural oils that kill bacteria and viruses. And then we have peroxide rinses. As we said before, peroxide rinses probably can kill the virus, but they're usually combined with glycerins and things of this nature. And then you have products out there that claim to have chlorine dioxide in them, but they don't. This is one is OxyFresh. There's another one that there are other ones out there that claim if they come in a one bottle system, it's not chlorine dioxide. In other words, it's sodium chloride. And sodium chloride is a precursor to chlorine dioxide. As you can see, OraCare has a 2-bottle system. When you mix these two together, a gas is formed. Actually, chlorine dioxide is a gas, but there is an oxychlorine species in the water that lasts for about, optimally for about an hour. It takes about 30 to 60 seconds to build up optimum amounts of chlorine dioxide, and then you have the patient swish with it for a full minute. Then we recommend if you're doing scaling or root planning or cutting the gum at all with your burr on a crown prep, and you're releasing more viruses into the mouth, you want to do a mid-course rinsing and then a post-treatment. When a patient gets out of the out of the chair and they're ready to go to the front desk, post-rinse is important. They're going to be numb. They're going to be spitting. They're going to be talking with aerosols, and you want them to go to the front desk, not spitting all over your receptionist and the countertops. Now, there are rinses out there that look like what we have, like this one here, Tri-Oral. You mix two together, and what you get is the reason they're mixing two products together here is to produce zinc chloride. Zinc chloride is not the same thing as chlorine dioxide. These two products, Tri-Oral and the other one there, I can't see it on my screen right now, but is all they're the same thing. They produce zinc chloride. Chlorine dioxide is an oxidative pre-rinse. It has the main surface ingredient is chlorine dioxide and chlorous acid. Chlorous acid is kind of the way it exists in liquid form, and as it comes out, it's in gaseous form. These disproportionate, and some of it disproportionates into actual hypochlorous acid. So chlorine dioxide is a gas acting much like ozone. As a matter of fact, it is so antiviral that it's actually been rated by the Lentech company as more effective against viruses than ozone itself. So because it has what is called a large oxygen capacity, even though it may not have the largest oxygen potential or oxidating potential. And I'm not going to explain the difference between those right now. But here's the disproportionation chart. You can see that chlorous acid is, which is chlorine dioxide, does disproportionate at times to hypochlorous acid. And so all of these species, chlorous acid, chlorine dioxide, and hypochlorous acid, exist in the liquid when you're using this rinse. This is a picture from my office. It's showing a patient with thrush, and I had them rinse with OraCare for 1 week, and they came back like this, absolutely clean. It does a remarkable job. It not only removes the pathogen, but it helps healing. Chlorine dioxide is a powerful virus killer, and this is the citation from Lentech Labs on the internet. It just shows that it actually worked better than ozone on viruses. The effectiveness, and then these are some studies on the internet that you can find, using chlorine dioxide against influenza virus and how effective it was in nursing homes. And the chlorine dioxide is now being tested in microchem labs, as I mentioned before, on the Corona 229E virus, which is a Corona 19 surrogate. And like I said, we should have that back soon, first week in June. So we'll let you know. Some chlorine dioxide proprietary rinses can be purchased. This rinse that OraCare produces can only be purchased by physicians and dentists and hygienists. We do not sell directly to the public, and we never will. We want to be able to teach patients how to use it. And so if you want to market this through your office, you can do so by registering on the site, oracareproducts.com. So that's where we'd have you go and get that. You need to register. And if you do, register at oracareproducts.com, and they ask you for the referral source, make sure you say Dr. Joseph Zelk. do not use my name. As an owner of the company, I'm not allowed to have any benefit from the sales of that product right now. Okay, next. Virus infection in periodontal pockets. We know from Dr. Jorgen's slots that rinsing can only reach about 0.1 millimeter into the pocket. So just swishing around doesn't do it. If you want to get down in the pocket, you need to use a water pick. And so we're recommending that you pre-rinsing with OraCare before the procedures. But if a patient takes the product home, which you can't do with povidone iodine, and I don't necessarily think patients would do it anyway, you want to do, and if you're scaling, you want to make sure that you irrigate under the gum line with the chlorine dioxide rinse while you're just prior to scaling and also mid-scaling, and then at the end, you want to use it under there. It will kill the viruses that are in the sulcus to a certain extent. We don't know how far down that'll happen, but we do know that it does work better than just rinsing alone. So if you want to know the rinsing protocol with a water pick, then you need to go to my Facebook site, American Breast Specialist. The American Breast Specialist, I have a protocol for water pick rinsing with OraCare, 2 to 3 times per week. Even Dr. Schlotz recommended rinsing with a water pick with, he actually used bleach, and he diluted bleach 30 to 1. Well, most people don't like bleach, and we think OraCare works better anyway. So the summary of pre-rinsing is that you want to do it after pre-rinsing before the patient gets in the chair. You don't want to have it inactivated substantially by the body, like peroxide is inactivated by catalase. We don't want that. It must be able to have a shelf life, a long shelf life, and it does. And it is very important that they do a mid rinse and a post rinse. So I appreciate, those particular items. Go ahead to the next one, please. Now let's talk a little bit about silent hypoxia. We've seen studies now showing that this is an unusual disease, the way it kills patients. They will feel fine, and then all of a sudden they'll feel shortness of breath. But long before they feel the shortness of breath and even have a fever, there are studies showing that the pulse oxygen levels on the blood go down. And you can actually detect or pre-screen patients for COVID-19 better with a pulse ox machine than I think you can do with a thermometer. And we have also the ability to do that with a very high sensitivity ring. But now this is a standard pulse ox that you can do on patients as they come in. Of course, each time you use it, you decontaminate with hypochlorous acid for the next patient. But you want to check their virus levels or their oxygen levels, and it might be a lot below 80, and they're not even feeling distress. And the reason they're not feeling distress is because the carbon dioxide is expelled from the lungs normally with COVID-19. But so even though the pulse oxygen is going down, the lack of CO2 in the lungs is not causing this distress, so they don't notice it. Okay, so let's go ahead to the next one here. So now we want to make sure that you know that this particular product is around. This is a COVID-19 screener that can be used. It's a high sensitivity circle ring, and it's spelled CIRCUL. And this particular ring will do a high measurement of oxygen levels. You can also record oxygen levels overnight, so we can use it in sleep medicine as well as a titration device for devices that we're doing with patients. Okay.
It'll give you a general oxygen desaturation index and a sleep apnea score.
Okay, circle ring. It's sleek and durable. It's a medically cleared home oximetry device. It has some FDA approval for pulse ox measurements. It can be used in finding oxygen desaturation index, and it's a very, very fine machine for helping you with not only COVID detection but sleep treatment.
Gives you sleep information too.
It's a high resolution pulse oximeter. It has the a CDC guideline for how to use it. So we'll cite that in our citations. This is a device that I'm a North American rep for. It's called Snoor, SNOOOR.com. This device has now been programmed. I'm just getting the new ones this week. You can monitor and program it to help people sleep on their side or on their stomach. It's been shown that people that sleep on their stomach with COVID-19 are breathing better. And these are the citations that we can talk about: prone position and improved breathing on patients with pneumonia and COVID-19. And you can rapidly pre-screen for COVID-19 with the circle ring. Okay, that's pretty much it as far as the presentation. You can get a discount with these products by going to dentalsleepbalance.com or smg2.net. And these codes for reduced fees is DRZZZ 2020. Thank you.
Good
Thank
job
you.
there, Dr. Downs.
Yeah.
It was a wonderful amount of information. Thank you so much.
Yeah.
So, where do you think our colleagues should start? I'm in a lot of groups and I'm seeing a lot of comments. I was just looking at a comment this morning that people are so fed up with all of the different information that they're receiving that they want to leave dentistry altogether and find something easier to make money with. Where do they start? How should they start? How do we start? We go back to the clinic. What are the first steps we need to take?
Well, my staff were particularly impressed with the air cleaning service. They thought that coming into an office where the where the air is full of ions that is constantly killing bacteria and viruses was very key for them to feel comfortable coming back to the office. And I think we already use OraCare in my office, so OraCare pre-rinsing was a huge thing. These suctions around the mouth, like Relief, are inexpensive. They're much less expensive than these large machines that you're buying with a big tube that sits over the patient's face. I don't have a lot of regard for that. I think it's not the way I do it. So I would say pre-rinsing is key. Air quality in the office is key. We want to reduce aerosol production and lowering it as much as possible with pre-rinsing, with in the mouth high-speed suction, and then the air quality that escapes from the operatories into the rest of the office needs to be addressed. I don't think just dealing with operatory air is not going to be satisfactory. Now, when we're done with the procedure, we can fog the office. We have the new fogging machines available. I don't think we have a price point on that.
The price,
might be
the price is $199
for the fogger. They'll hook up to your air outlets in the offertory. But I think I'm straying afield from your question, Dr. Shaw. So,
but use hypochlorous regularly.
Rinsing and air quality. That's probably what I would do. But they're all important. The surface cleaners. I mean, you can clean with Cavicide, but the Dolphin Pods are less expensive. Over a long run, you're going to save money with Dolphin Pods, and I think they're more versatile.
It's about $8 a pod.
We don't recommend you use that hypochlorous acid from Dolphin Pods in your water bottles next to your chair. It's too highly concentrated. We are developing a product that has a 5 parts per million hypochlorous acid for chair side use, but you can also use the ozone for that. If you already like ozone and you use it, it's great for water bottles.
The Hepa filters are a challenge because they don't capture the viruses that are the viruses are too small, so they pass through the Hepa filter.
Okay, what treatment do you recommend we avoid in the beginning? What treatments? Oh, well, I can see that question there.
You can tell Rick can't hear me.
When people come in with a toothache and they need a tooth removed, what are you going to do? I'm going to take out the tooth. I mean, that's just what I'm going to do. If you have to do it, you have to do it. I don't know. There are probably going to be some state guidelines on if you produce an aerosol. Anytime you produce an aerosol, you have to, if you want to reuse that mask, you got to decontaminate it now with ultraviolet light. You have to do that, and you can't change masks with another staff member. So you got to have something that works. Peroxide will work. Peroxide's good. Nothing wrong with peroxide to decontaminate your mask, but you don't want to use hypochlorous acid. That hypochlorous acid that we recommend should not be used on masks for PPE decontamination. Fumigation, let's see, ultraviolet light. Let me see, I'm reading that quick. Ultraviolet light, which one is more effective for fumigation? Well, I think ultraviolet light works. You have to have some contact time with ultraviolet light. As we said, the lumen machine, when you're decontaminating masks, takes 5 minutes. Okay, so I think fumigating the air in the operatory right after you're done with the patient with 500 part per million of hypochlorous acid would be great for quick air kill. Hepa Filter from Inger. Okay. So this somebody says they have a filter at 0.003 microns. I've never seen that. If you got a filter at 0.003 microns, the smallest virus I've seen is 0.004. So theoretically, I would think that microfilter that small would probably remove that virus. That's I've never seen that before. I don't think I would avoid Profis. I would put in the high-speed suction. I mean, when's your hygienist going to go back to work? Are we going to wait a year and a half before we put people back to work? I just don't think that's going to work. I just don't. I can't imagine. We got to at some point in time we got to do regular dentistry again, and that's why I'm trying to develop these protocols that would make people possibly feel safe to go back to work. I don't know how else to do it. I'm not really willing to wait a year and a half for complete mitigation of coronavirus 19. Okay. Do you recommend COVID-19 tests for all patients before treatment? Well, no, I don't recommend COVID-19 tests for all patients. I would recommend COVID pre-screening with the circle ring or pulse oximeter or thermometer. I think everybody needs to be questioned.
There's a questionnaire, yeah.
Screen. And there are going to be patients that come into your operatory that have active COVID-19. In this situation, the CDC says that's a severely high risk.
There are antibody tests too that we can provide.
The high-speed vacuum, the rinsing, the shields, the fogging, everything's got to be in place. Okay, so fumigator or fogger, which is better? I don't know much about fumigators. I can't tell.
Yeah, I think the foggers will do a better job of dispersing the cleaner.
Probably the same thing. Maybe. I don't know.
So, Dr. Downs, how much is this estimated going to cost us?
Okay. Well,
to be ready to go back to practice.
Yeah, the Dolphin Pods. A box of Dolphin Pods is like $318 plus shipping and handling. Okay. That Dolphin Pod package is 40 tablets, and you'll probably save over using Cavicide, and you won't have the problems with landfill with those rayon wipes in there that are very wasteful, by the way, and not very good for breathing. So I would say $318 plus shipping and handling, which I don't know what that is for everybody. And then the Clean Air AXP, I think, is $19.95 per unit. So if you have 3 air handlers in your office, you'd have to buy 3 of those. And then I would think the circle ring is about $299. I'm trying to. You got me caught off guard here. The ultrafiltration system. They have units for around $900 for a 5 operatory office, and then if you go up over 20, then the price increases. Not multiples of that, but probably over $2,000, I would guess.
The Ozone machine's a little over $2,000 also.
Not sure what. You'd probably have to let us know how many operatories you have and your water
How many operatories and what square footage you got?
So everybody thought, OraCare. Well, OraCare, there's an operatory size rinse. There are two 32-ounce bottles that you mix, and those are less expensive than the regular patient size rinses. But a case of that is 3 sets in it, so I do 3 operatories, and it's about $119 for a case, and plus shipping. And then there's the patient rinse, and the patient rinse is 8 sets of rinse in a case, and I think that's $219 a case, plus shipping and handling. Everybody gets OraCare at the same price. Everybody gets it at wholesale. You just got to go to oracareproducts.com to order now. This is not available in every country. I'm sorry to say. There are probably a lot of international people here, and not all these products are available in every place. I'm sorry about that.
The fogger is a quick release 2-year air in your operatory. So
anything else?
That'll be $199 per fogger.
Okay, it's just I don't see any more questions right now.
Yeah, so here's one. I think this has to do with humor. Do you think this is a good setup?
Well, that's I mean, yeah, that's a lot.
It's a lot.
I think we're going to scare the patient out of the room. I think their barriers are good.
I'm not going that far.
But I don't know how far you go with it.
I'm fogging my patients and myself with the hypochlorous.
I've never seen one. Somebody show me one sometime. So I understand that, and you don't want to approach a patient in a hazmat suit either. They're going to run out of the
way.
The question is, what do patients feel when they come to see this environment here? It's a bit already scary.
They're already scared enough.
They're not coming in.
I would say if you have the clean air system and all these protocols in place, you can talk to patients and tell them. Like in my office, I work for a dentist now. I sold my practice, but he's put in these systems, and he can say, I have the safest, cleanest office in Iowa. And I think he could say that with confidence.
Sure.
I think patients would appreciate that because they want to come. They don't.
Can I ask you a frank question, Dr. Downs and Dr. Zell?
Yeah.
We have always had universal precautions, okay? This is not new to us, right?
No.
We know that we have to accept all patients unless they're on active tuberculosis or something of that sort, respiratory disease. What is all this hype about with this particular respiratory thing? If we have had universal precautions and we were supposed to follow them all these years, I mean, I understand it's going to make us a little bit more aware of our infection control methods.
I believe that's right. I think it's opened our eyes to how inadequate we might have been with certain diseases, and flu in particular. But really, I don't know what to say to that. It's a very good question, and everybody's thought the same thing. Well, if it was universal precautions, then why wasn't that adequate before if it's not adequate now? I don't know.
Well,
I really don't know.
The communicability of this is the problem.
For me.
It's highly.
But I'm in the same boat.
Yeah.
I think we've done a pretty good job.
But this is a real good question to pose to the CDC.
Yeah, I think so too.
Dr. Shaw, there's technology out there.
Guidelines multiple times, and they've made predictions multiple times too. I'm as confused by the CDC as I am anybody else, but we're trying. Is visit D and diet.
Well, vitamin D has been
I think there's
big
some evidence
conversation.
that shows that vitamin D is good for you and helps you become more resistant to COVID-19 complications and severity. I think that's true.
You can safely take 5,000 IUs of vitamin D
people should be
daily
up on
for
their
months
vitamin
without
D levels if
causing
you
a risk for.
want that implant to integrate. And
yeah.
So I think that's good. And OraCare, we've recommended it around implants for years. There are products out there, including fluoride toothpaste, monosodium fluoride toothpaste. It seems to corrode implant surfaces. whereas the stannous fluoride toothpaste don't seem to do that. So I think that I'm recommending all my patients go on Periodontax or Crest detoxify toothpaste, whatever they call that.
There's been a couple trials on
I'm doing
low
that
vitamin
now.
D levels that show a much
show
higher prevalence of contracting viral disorder if you're lower than 20 on your blood levels of vitamin D. Over 30 was protective. 40 to 50 is actually optimal for good immune system. So I think
excellent.
How you doing?
Good to know you guys' positions on the vitamin D as well.
Yeah.
So, okay,
and remember, that's just immunity improvement there. And that was there. If you go on to PubMed, you'll see that there was a recent
thank you.
test of that.
I appreciate it. I'm honored to be here. And I wish Dr. Zelk could have been heard. I'm sorry that he's such a knowledgeable man, and we're working together on this project. If he hadn't been there, we wouldn't be able to see the slides.
That's right. That's right.
Thank you, Joe.
You're welcome. You're welcome.
So, gentlemen, any other recommendations that you guys might have in the months to come for our colleagues to find a proper source to get their updates? Everybody's sending out different updates. Every society, every organization, the state, the regulatory bodies, the governors.
Oh, I'm learning every day, Dr. Shaw, and I agree. Here's the thing: we're constantly adding products to our line. We're trying to improve our infection control protocol. Okay, we're trying to do that. Yes, zinc has some antiviral roles. Of course, zinc will help. I just got a question there on zinc. I think zinc is good. What I think about, if you go to smg2.net, that's Dr. Zelk's website, he will constantly keep you updated. Right now, his office help is helping people sort through their needs. In other words, you can fill out a form there, ask questions, and get good answers from them. My site, I'm having a click to buy products, and also I will have information. Both of these are sleep sites, so we haven't put up a site that's just on infection control yet. So we'll constantly try and keep up with you. My site is dentalsleepbalance.com, and that's where you buy. And then in any instance, if you want to purchase products, you can get a discount with that DRZZZ2020 code. That'll help you get a little bit of cost savings if you're interested in that.
Yeah, we've
Is
got
there any
discounts
connection
with
with oral health and complications arising from COVID-19? I don't know. I don't know. It's too early to know what the oral health effects of COVID-19 are. I'm thinking that when you go into that cytokine storm part of that multi-system failure with cytokine storms, I could imagine that would affect your gums. But at that point in time, I would think that right now they're trying to save your life. They're not looking at your gum disease. Okay.
Well, don't forget about their oral airway either. You know, you got to think about your sleep apnea, and dentists are looking in there all the time. So that's important too. Sleep apnea is a very, very high risk factor for sleep for COVID exacerbation because it's linked to inflammation, obesity.
There,
you know, it's
very fast, but
it's an area that dentists can really make a difference in as well.
I think if you email me or Dr. Zelk, you'll be fine.
Yeah, we've been walking a lot of dentists through this process, so we're here for you.
Anything else, Dr. Shaw?
That's wonderful. Thank you, gentlemen, so much for your time of bringing this valuable knowledge to our colleagues.
Okay.
And we look forward to having you at our or future summit to collaborate with us.
If anyone wants to learn anything about sleep apnea or Dr. Shaw, we also have a webinar for them too, because that's a low aerosol procedure. I think dentistry would like to add to their products too. So,
but we did our best. Okay, thank you.
You got it, gentlemen. If you guys see any other questions on the site in the days to come, please address them. They'll be on this website. my friends and colleagues, thank you for tuning in today. We have some exciting webinars tomorrow, specifically from Germany and again back to the United States. We look forward to being of service to our colleagues. Thank you so much.
Thank you very much.
Take care.